and great to have you both with us tonight.
Thanks, Shannon.
Thanks, Shannon.
All right, let's start on schools. Today, thedailywire.com has this headline. CDC says it will release official guidance on reopening schools this week. Biden says he will comply. They also note Dr. Congressman, I'm not sure which title to go with, sir. They note that the CDC has had guidelines out. It's not like they've been silent on this for the last several months, but we will get another round this week. Where do you think that the president goes in trying to navigate between the teachers' unions and whatever he gets from the CDC?
Well, I hope he starts listening to the CDC and listening to the science, because you're right, Shannon. We've had that guidance out for a while. We had that out during the Trump administration. And then the president's own appointed CDC director just recently put out the same information, as well as his chief medical advisor, Dr. Fauci. So it's kind of shameful right now, but President Biden's really being manipulated by the teachers union right now. They own the president to some extent. The relationship between the Democrats and the teachers union is pretty incestuous, and it's all about money. And there's going to be a ton of money in this $1.9 trillion stimulus package that's pushed out that's going to go directly to the teachers union. That's going to get recycled right back to the Democrats, including President Biden. And so they're really in control here, and they're letting him know that they're in control. And I just think it's shameful that they're demanding that they get vaccinated before they go back to school. We still have elderly people, people with pre-existing conditions, and first responders that haven't been vaccinated yet. They are a priority. The teachers are not a priority for vaccination. It's not required for them to get back to school. Even the CDC director said so.
Well, on the topic of vaccinations, Alex, this is something that you dig into and you share data with people all the time. You're very active on social media. And tonight now we're hearing that Facebook is going to do some more editing when it comes to what people can find out about vaccinations. The New York Times says this headline: Facebook says it plans to remove posts with false vaccine claims. So we have questions about, well, who's going to decide what that means? Facebook said it consulted with the World Health Organization and other leading health institutes to determine a list of false or misleading claims around COVID and vaccines in general. Alex, do you think that that is a good plan?
Well, I think in general, big tech has behaved really badly for the last several months in terms of free speech. They've censored free speech more and more aggressively. Look, there's a bunch of stuff you can say about vaccines that are clearly untrue, right? You can say, oh, you're being injected with computer chips that are going to control your brain, or, this is an effort to depopulate the planet. That stuff is stupid. I mean, I wouldn't ban it, but it's stupid. But there's a whole bunch of stuff that is, that's basically scientifically open to debate at this point, including how well the vaccines actually work in the real world, and including whether or not the sort of claimed 95% efficacy is anywhere near accurate. And if Facebook is going to, prevent me, or Twitter is going to prevent me from pointing to government data and scientific papers, I think that's wrong. I'm not saying that I know they're going to do that, but there's been considerable squelching of free speech and public debate in the last year around masks and around lockdowns, and they shouldn't do that about vaccines.
Yeah, because as you said, there are a lot of things that even scientists and doctors don't agree upon. That's why we have debate, and the information is necessary to have an open, transparent debate. Congressman, I want to talk about this because you wear so many hats, and because you are based in Texas. We covered in that last report about the concerns that they have down near the border. Now, one of these comes from a Texas state senator who is a Democrat, and is very worried that people are being allowed across the border, processed, and set free into the U.S. with a court date to return, but without ever being tested for COVID. He says that's very alarming to all of us, in that they're coming from Central America and through Mexico, and to be released into the United States without being tested for COVID is really unconscionable. It doesn't seem to line up with a lot of the other restrictions that we're, observing here in the U.S.
Well, it's absolutely right, Shannon. There's a double standard here for, what fits into the president's social agenda that's being driven by the far left, and what doesn't. And we're right. His open border policy that he's pushing out right now we have to worry about not only about, drugs and gang members and rapists and murderers and all the other stuff that's coming across our border. We have to worry about this infectious disease. They're not testing anybody that are currently in the United States that they're being required to release right now. And they're encouraging thousands and thousands of people to come to our border right now in large groups that are going to, certainly some of them are going to have COVID. They're going to be released into our communities as well. So this is not a good plan. This is inconsistent with the president's verbiage on for the rest of us and his instruction to the rest of the country. And so I think it's very hypocritical, and it's once again it's being driven by the agenda of the far left, unfortunately.
Yeah, when we know that there are a lot of people who are coming here simply seeking a better life or some kind of economic way to survive, but when you have people from both parties worried about them actually being screened so they can be here safely in the U.S., that's a question that has to be answered. Alex Berenson, Congressman Jackson, great to have you both. Thank you.